Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. So today we are looking at the vocal cord palsies and their types. So to begin with, the UL abductor, that is the unilateral abductor. So in terms of the unilateral abductor, the nerve involved will be the RLN and this will be the left. Next, what will be the cord position? It is going to be paramedian. Then voice, if you see, it is going to be hoarse voice. And the dyspnea and aspiration is going to be, it is going to be negative. Then how to treat? The treatment will be the wait and watch. So you wait and watch, and the palsy with the least consequence. Next we move on to the bilateral abductor. So bilateral abductor, the nerve it involves is RLN. Since it's bilateral, it is going to be RLN, that is both. So the cord position here is going to be, it is paramedian. And when you look at the voice, it will be good. The voice is good. Then how is the dyspnea? The dyspnea will be positive, and looking at the aspiration, it will be negative. So how is the treatment here? The treatment here is going to be tracheostomy and the lateralization. So it is tracheostomy as well as the lateralization. So in bilateral abductor, the dyspnea is positive, aspiration is negative. Next we move on to the unilateral complete. So in unilateral complete, what does it include? In unilateral complete, it includes the RLN plus the SLN. And always when it is unilateral, we talk about only the left. So it includes the left. And how is the cord position? The cord position is going to be cadaveric. In unilateral abductor, it was paramedian. And bilateral abductor, it is both in paramedian, and unilateral complete is going to be cadaveric. So how is the voice? So in terms of unilateral, it is going to be hoarse voice. And looking at dyspnea and then aspiration, dyspnea is negative. Aspiration, it can be plus as well as negative. Now what will be the treatment of this? So in terms of the unilateral complete, the treatment will be to wait and watch as well as the medialization. Then we move on to the bilateral complete. So here in bilateral complete, it will involve both the RLN and so it includes RLN plus the SLN, and it includes both of them. So how is the positioning? Positioning is going to be cadaveric, that is the intermediate position, and the voice is going to be, there is aphonia. So what about the dyspnea and the aspiration? So when you look at the dyspnea and the aspiration, this will be negative and then positive respectively. And when you move on to the treatment will be tracheostomy. And so tracheostomy, it was similar to that of the bilateral abductor. There also we had tracheostomy. So in terms of bilateral complete, it is tracheostomy. This was one. And along with this, there is also the epiglottopexy. There is epiglottopexy as well. To learn and grow daily like this, please do subscribe.